Cap, let's put the spotlight then on Chrys Capital that has invested $100 million in New Delhi-based Center for Sight for a significant minority stake. It's a deal that's going to value the eye care chain at about $350 to $400 million. Let's understand the contours of this deal and what it exactly means. We've got Dr. Mahipal Sachdev, who's the founder at Center for Sight, joining in. Dr. Sachdev, thank you so much for taking time out. Just start off by giving us an insight as to what exactly is the view when it comes to the fund infusion from Chrys Cap.
Okay, fine. Thank you very much. This is our third round of fund infusion into Center for Sight. The first round having been coming in 2010 and a slight smaller in 2013 from Matrix Partner. And 5 years ago, Mahindra invested into Center for Sight, and this is the third PE company that is investing. The total deal size is close to about 100 million, kind of split between a primary and a secondary sale for Mahindra and Mahindra. And some ESOP holders are also divested in this particular stake sale.
So can you also walk us through the contours of this deal? I understand that Chrys Cap is going to purchase the entire stake that's held by Mahindra Holdings. Can you tell us a little bit more about that investment and what this pegs the overall valuation at?
Well, from a valuation perspective, I think they'll be having about a 40% plus stake. As you can know that the amount that they have invested is above 800 crores. So you could work on the valuation around that.
So, Dr. Sachdev, what's the outlook when it comes to the utilization of these funds? You're looking to really serve the demand for eye care in India. Take us through how exactly that is growing, what the outlook is when it comes to penetration in tier 1 and 2 cities.
Yeah, basically, as you can see that specifically post-COVID, the demand for healthcare and better healthcare has gone up significantly. And so has also the demand for great quality of eye care gone up. Now, unfortunately, India has a very significant load of eye problems, first being cataract. So in India, we do close to about 75 to 80 lakh cataracts. We means the Indian ophthalmologists. And this would be equal to the sum of US, Europe, and China put together. So that is a great load, and that's the largest surgery that we have. In addition to that, there is a growing demand for refractive surgery, that is laser vision correction for correction of refractive errors. And also, as you know, that diabetes, India is the diabetic capital. So there is a significant involvement of the eyes as regards diabetes. So therefore, there is a lot of treatment modalities that are available to stop diabetic blindness, age-related changes, etc. So there is the gamut of eye care services has gone up significantly, and quality eye care with precision, efficiency, and great outcomes has gone up. So there is I would say in India, there is a lot of consolidation that is happening as regards good quality services, whether it be in healthcare or it be in eye care. And of late, there has been a significant interest of the private equity players into investing in the ophthalmology space. So we as Center for Sight started in 1996 and have grown today to about 83 facilities across India. And we are there in about 15 states that we have today with about 3,000 staff strength and 300 plus 350 doctors that we have, eye specialists and ancillary doctors who work with Center for Sight. So that is the situation, and there is a CAGR, I would say, of the ophthalmic industry that is pegged around 12 to 14% in the eye care industry that is happening. The obvious advantage of eye care being that it is a daycare procedure. We are not constrained by the number of beds or anything like that. And we are, I would say that there is an excess capacity today as regards the ORs that can be taken. So the block comes in eye care at the OPD level. That means when patients are coming for the initial examination, they need to get dilated, etc. And that takes a little while. But overall, I would say that Indian ophthalmology today stands significantly better than any other country or equivalent to any other developed country as regards delivery of quality eye care at a fraction of the cost as to what it is. And there is very little outbound traffic of patients from India to get eye care from overseas. Rather, there is an inbound traffic of patients to come in to India to get the eye care treatment. So overall, I think this industry is showing a great amount of consolidation and a great amount of, I would say, growth, which is there, and it is spreading towards tier 2, tier 3 cities. Obviously, we have great ophthalmology setups.
Right, that's quite interesting. And what about the annual footfall that you currently command and the kind of footprint that you're looking to grow?
Yeah, as regards the footprint, I told you we have 83 facilities. We have ancillary business also of the pharma and the optical space. So we have close to about 83 outlets or facilities across 15 states and more than 35 cities. That's what our footprint is. And as regards the number of patients, we see close to about 1.5 million patients every year. As regards surgery and the injections and the procedures. The OPD would be about 10 times higher than this. That would be about 15 lakhs or 1.5 million. So that is the footprint. Daily, on a daily basis, Center for Sight across its facilities has a footfall of 4,500 at an average to 5,000 patients every day walking into Center for Sight.
So when we talk about your financials, I think it was revenues of about 500 odd crores and EBITDA of 105 crores for FY24. Walk us through the details and what are the plans when it comes to your IPO? Earlier, the plans had been shelved in the year 2017. Any updates here?
Okay, so basically, as we stand today, we were in the last financial year a little shy of 500 crores as our overall revenue. And if we look at our Indus EBITDA, that would be 100 plus in the last financial year. We are hoping to be in the bracket closer to about 40% growth from last year as regards the EBITDA, and as regards the revenue, I think we should be growing at about 20% or 25% year on year as regards the revenue. And this actually is going to come from a combination of about 7 to 8 new greenfield places where we are going to open, as also a similar number of joint ventures or acquisitions, whatever you wish to call. Because post-COVID, again, what we have seen is that a lot of single practice ophthalmologists are willing to go into joint ventures or partake majority of their stake to the corporate chains that have come about in ophthalmology. And I think Center for Sight is in a unique position because out of the corporate chains that are there, we are the only one where the founder ophthalmologist and the promoter group are enjoying a majority stake as regards the cap table today. So we are going to have an equal growth coming in from these acquisitions as also from the greenfields. And the moment we are between 150 to 200 CR of EBITDA, I think that's the time when we are going to start looking at an IPO, and I hope it should be between the 2 to 3 years time frame which is there, or maybe earlier.
And finally, Dr. Sachdev, what's the long-term vision then for Center of Sight?
Yeah, so from a company perspective, I think we are hoping, as I said, to double in the next 3.5 to 4 years, and 5 years obviously would be maybe about another 25% growth from there. We are, as of now, totally focused on India. We would go to places where we have a presence and do a deeper penetration. We started out of Delhi NCR, and that is the place where we have the maximum brand equity as also the maximum penetration. But we extend from Jammu and Kashmir up to Hyderabad area, as also to Vijayawada, and in the east we are up to Guwahati. So north and east, as also parts of central India, are going to be our focus area where we are going to do. Over time, we have also concentrated on smaller outreach vision centers rather than having the hubs that we create, because typically we work on a hub and a spoke manner. And whenever we have established our presence in a particular city, we go ahead and do these spokes, which could be having the basic cataract facility and medical retina, but for super specialized work like surgical retina, corneal grafts, or refractive surgery, the patients would come to the hubs or the tertiary or the quaternary centers that we have. Suffice to also, I would also wish to add that Center for Sight also has a robust DNB program for training residents, as also we have a lot of fellows and we do a lot of continuing medical education, so that we can also bring better quality of ophthalmologists in India, as also retain the best out of these DNB people and the fellows to continue working with Center for Sight and maybe help us in establishing our footprint in tier 3 cities.